It is a dire situation at hospitals all across the state. The number of COVID patients are doubling every 18 to 19 days. Most are not vaccinated. And in some hospitals, they are running out of beds. And this is why healthcare workers are exhausted and stressed. I sat down with one ICU nurse who's been saving lives for the last year and a half, and she's reached her breaking point.
As healthcare workers, we're all struggling. We're having a hard time getting through this. We're exhausted, and it doesn't need to be this way.
Kristina Zeh has been on the front lines in the fight against COVID. As an ICU nurse at Providence, Everett, she's been treating the sickest patients, and they just keep coming through the doors. Tell me about the kind of patients that you're seeing in the ICU right now.
All of our patients are not vaccinated.
What does that say to you?
That the vaccine keeps people out of the hospital. A big reason that we're seeing that people chose not to get vaccinated is because, their friend or their neighbor got COVID and they were okay, so they didn't think that it was a big deal. And we're seeing some patients who have no other risk factors and are fairly young who are getting very, very sick and sometimes dying from COVID.
Witnessing so much suffering and death has taken a mental and emotional toll. But what's even worse is she believes this new surge in cases was preventable. You mentioned that treating patients now feels different than when you were treating patients a year ago. Tell me why.
Now, the patients that we're seeing in the ICU, we recognize that it's a personal choice, that they made a personal choice, and that's what brought them to us. And of course, we will do everything that we can to treat them. It seems strange to me that somebody will choose not to get vaccinated because they don't trust the medical community or science or what we're telling them. But then when they're sick in the hospital, they want every therapy that we can provide them.
That frustration, combined with all the divisiveness over masks and vaccines, has some healthcare workers calling it quits.
We see people discouraging others from getting vaccinated and wearing masks too, and that's hard to see when you see the worst of COVID every day when you go to work.
The stress, burnout, and fatigue became too much for her, and a few weeks ago, Zeh left her job in the ICU.
I got to the point where I felt that the cost of working directly with COVID patients in the ICU was too high. I decided to leave because I just couldn't emotionally or mentally get through another surge of COVID. A big part of me felt like I was needed, my skill set was needed, but I also needed to take a step back and take care of myself first.
Zeh has moved to a nursing job in another area of healthcare, but she's worried about the staffing shortages. Contract workers are being brought in to fill the gaps, but she says they're not familiar with the hospital systems, and she worries about the impact that will have on patient care.
And the sick thing is, this is all preventable. This is all avoidable. She didn't think we were going to have to go through another surge of this virus. We thought it was over.
She thought there would be light at the end of the tunnel, starting at the beginning of the year. She never thought that this surge would come on as fast as it has.
Yeah.
And she really stresses this was something she thought long and hard about. It was not an easy decision for her to leave that critical job that she knows where her skills are needed the most, especially right now.
Right.
But mental health and taking care of yourself is also a big part of maintaining her own sanity. And so that was a decision she made.
Day in and day out, having to deal with that sort of trauma and grief. Unbelievable.
And I asked her, how many deaths have you seen?
Yeah.
And she said, too many to count.
Too many.
Yeah.